Welcome back to another episode of the Skinfluence Podcast. I'm your host, Dr. Dustin Portela, board-certified dermatologist. As always, joined by my co-host, Austin.
I'm Austin Lee, physician assistant, excited to talk about everything hair removal.
So it's a common question, and probably the most common cosmetic procedure done in dermatology offices, maybe short of Botox, is laser hair removal. But we're going to be talking about all the different kinds of ways that people remove hair, how to do it safely, and the pros and cons of each of the different kinds of hair removal.
Yeah, we'll talk about what not to do, what to look for when you're coming in to get laser hair removal, or if you're looking to remove your hair, if you're a candidate, and all the above.
Yeah. So a lot of different ways to remove hair. The most common is shaving.
Shaving. You got to love shaving.
Yeah.
It's just the tried and true. It's been done probably since Cleopatra.
Right. She
probably
pioneered it.
It was probably her who started the shaving trend.
So shaving is, something that many men do on a daily basis. Some women do on a daily basis. Mm-hmm. And the principle is using a very thin but fine razor to remove hairs at the surface level of the skin. But there's lots of different devices out there.
Totally. I don't even use a razor blade still. Mm-hmm. I don't know, just because my hair's not thick enough. I don't really need to. I use an electric razor, but I use two different types of electric razors, one for my neck and one for my face.
So what's the difference between the neck and the face? Like what kind do you use on the face versus the neck?
So on the neck, I use the straight electric razor. I don't know what
like the foils
name. The foils.
Yeah.
Just because my hair, when I use the circular ones, it doesn't catch them all.
On the neck?
On the neck.
Yeah.
I have to kind of go up and down and then sideways on the neck, and then sorry. I use the circular ones for the neck because my hair grows in different directions on my neck. And so that circular coils or foils, they catch those different hairs coming out different directions.
Yeah.
Whereas they don't do as well on my face. I just kind of go up and down on my face with the straight foil.
Okay.
And it does a better job. And then when I'm done, it feels like a pretty nice close shave.
Yeah.
It's not like using a straight edge or anything like that.
Right.
But it gets the job done, and I don't have a lot of dark hair. So.
Right. Yeah, I shave more than the average person probably because of my head. So let's talk about razors. Started out, like I remember my dad having those disposable Bic razors.
Yeah,
with
totally.
Like one blade, and then it was two blades.
Yeah.
And then they started making the 3-blade chick.
The Mach 3.
The Mach 3. And then some people were making 4, and now we have like the Gillette Ultra 5 blade. Yep. Oh, and they all have a little blade on the back, so there's technically 6 blades. And I don't know if this was I think it was a Saturday Night Live skit making fun of the razor industry.
I haven't seen it.
And they came out with the Quintipio 15 blade. And it was like this long.
Huge.
So yeah, it was like 5 inches, and there's multiple. It looked like they had just converted a spatula into a razor. And, in the Saturday Night Live commercials, people were just shredding their face with these razors.
Oh, yeah.
So the more blades that you put on it, you do generally get a closer shave. Mm-hmm. But you can risk more irritation because each pass of the razor blades can lift and then cut the hair to the level where it falls below the skin.
Yeah.
And then if your skin is more sensitive, you could be at an increased risk of shaving bumps or ingrown hairs. And some people are really genetically prone to that. Some of the areas that are worse there is going to be like the back of the neck or the front of the neck, really. So back of the head or the neck, where the hairs do tend to come out at different angles.
Yeah.
They can be a little more curly. African Americans have higher risks of what we call acne, keloidalis, nuchae on the back of the neck, pseudofolliculitis, barbae on the neck or the face, where you're getting more of these ingrowns. And so if you're prone to a lot of ingrown hairs, the general advice that we give people is go back to that single blade.
Yeah.
And shave only with the grain of the hair.
Yep.
And that will leave probably a small amount of stubble, but that's what you want, because if it goes below the surface of the skin, your risk of getting ingrown hairs is high. So it's better to leave just a little bit out on the surface of the skin.
Yeah. One of the main reasons why I don't use blades is because of that reason. I get ingrown hairs. I have to shave across my neck if I use a blade. But I have a lot of moles. You probably can't see in the cameras here, but I have quite a few bumpy moles. And so anytime I shave with the blade, I'm nicking those things and I bleed all over the place. So I tend to stick with the electric razors. But yeah, using multiple blades, especially, I can go up to the Mach 3 and maybe do okay without nicking my face. But anything above that, I'm cutting myself fairly regularly, which I feel like is a bigger risk. The more blades there are, the more chances there are to nick yourself. But yeah, as you explained, the more blades there are, they're pulling that hair out of the follicles they pass. And then after it's cut, it'll go back underneath the skin. And then as it tries to grow out, it can cause a lot of irritation. But yeah, like you were saying, a lot of mistakes that are being made are they're shaving against the grain, not shaving with the grain, using multiple blades. And very often another mistake that's made is people don't intentionally shave. So when they're shaving their face in the morning, it's, I got to get up, I got to shave really fast. And now they're just they're just damaging the skin. But intentionally taking time, making it kind of a little routine where you get the shaving cream on and you slowly shave and because it's your skin. It's what people are going to see. You want to preserve your skin. You don't want to damage the skin barrier. You want to take care of it. And nicking the skin and providing opportunities for bacteria and inflammation to happen is just going to aggravate your skin over the long run.
Yeah. And a lot of women will use, razors with 1 to 3 blades to shave their legs, their armpits, things like that. Generally, that's not going to cause a lot of problems. But again, you should slow down, take your time to do it. And if this is not a common problem, but we do see it in the dermatology office. If you ever get flat warts on your legs, I've seen many women who have now shaved over the flat wart and they reuse the razor, and it just causes that wart to propagate up the leg, and they get dozens of warts in these areas where they're shaving. So it speaks to the necessity to change your razor out frequently. Be careful around any bumps that you have. If you don't know what it is, see a dermatologist and have that taken care of. As far as the electric razors go, if you are prone to ingrown hairs on the neck, on the back of the head, or on the face, electric razors, they don't cut quite as close, and generally there is less risk of ingrowns. And if you're getting ingrown hairs all the time, you don't want to be shaving super, super close.
Yeah. And that's a good using the electric is a good way to avoid that.
I get asked all the time what I use to shave my head. I get a lot of messages from wives whose husbands are bald, or from guys like, hey, what's your scalp care routine? So the best razor that I have found to shave my head that's electric is the Bronze Series 9, and it's those straight foils.
That's what I use on my face.
It's such a good razor.
It's so good.
And that will give me a very close shave. And my wife got me one of those like skull shaver ones that have like 5 rotary blades.
Oh yeah, and
on the top.
You kind of grip it.
And I see their social media videos, and people have like, a 1/4 inch stubble, and it's just one pass and it's all gone. I'm like, I don't know how they can work that well.
Yeah.
So I got one. It doesn't work.
No.
Like, it's not a close shave. I don't think those devices are super good.
A company sent me one, and I was really excited about it, and I was disappointed. Yeah.
And then it's awful for the neck. It's just so bulky. I can't shave my neck with that.
You can't get around things. No. Yeah.
So
I agree.
So I didn't use that one very long for my head. When I'm in the shower, sometimes I want a really close shave, and I use the Gillette Labs 5 blade.
Oh, yeah.
And I have a pretty smooth head. I don't have a lot of moles or bumps, and so it works really well. But I did nick a mole on the back of my neck the other day and saw blood on the towel. So I use different things, but do it carefully and slowly. And so shaving.
That's shaving. Another form that we see is waxing.
Yeah.
Waxing was a fun thing to watch in The 40-Year-Old Virgin.
Kelly Clarkson.
They waxed a happy face in his chest. They actually did it. But it is painful. Yeah. Have you had waxing done before?
So I haven't had waxing done, but I had sugaring done, which is a very similar process, but it uses, a sugar-based solution instead of wax. And the people who do sugaring will say that it's gentler on your skin.
Sure.
It still hurt like a mother.
Oh,
It hurt bad. I recorded the whole thing. I think I posted it years ago. But I had my whole chest sugared, and then it was so itchy when it started growing back, because you put this on and the wax or the sugar dries around the hair, and then you rip it off, and it's pulling the hair out by the root. And it's a tender process. And this is how I know women are tougher than men, because they go get the Brazilian wax.
They willingly do that.
Yeah. And so, waxing. Now, waxing can be a really good way to remove hair. It doesn't matter if the hair is dark or light colored. It can be done pretty much anywhere on the body. But it is something where you want to go to somebody that has experience doing it.
Totally.
If you're not careful, the wax can burn the skin. And if you are taking Accutane, you should not do waxing.
Yes. That is one thing I warn my patients. I had a patient wax their eyebrows on Accutane for prom, and the skin came right off with it. It was sad. I was like, oh, sorry. Yeah, it's in the, you signed the paperwork. It's in there.
Yeah. So I did sugaring, would not do it again.
Yeah.
More power to the people that can tolerate that.
I've waxed half of one of my legs once.
Really?
In swim team, whenever you had like an important meet, we would shave and we were like, let's try waxing.
Yeah.
And that hurt so bad. And one of the guys got burned, and it was just, it was a disaster. Yeah. But props to women who go and do that. Yeah. Often, because I couldn't take it.
No, I couldn't either. Another common thing that you can do over the counter are what we call depilatory creams. And so this is going to be creams like Nair is a common brand name. Yeah. I think there's another one called Magic Hair. And what these are is essentially an enzymatic chemical where you put it on and it literally dissolves the hair. So it's not taking it off all the way down to the root, but you leave it on for a time and then you can literally just wipe the hair away because it's degraded its attachment to the underlying structures in the skin. And this is commonly encouraged to be used on the legs. You could do it on the arms. It's not ideal for sensitive areas. And if you read on the bottle, it should not be done on the face because these enzymes can cause some facial irritation. And especially if you leave them on too long, you can get, chemical burns of the skin.
Yeah. Yeah. Nair was really big when I was in high school. I'm sure it's still around and people probably still do it. But people, I remember there was a girl who did Nair on her arms in school, and it looked like she had like bad sunburns for a while from it. And it always scared me after that.
It can be really irritating. When I was in medical school, I was rotating through the emergency room, and we had a guy come in late at night, and he had used Nair in his genital area. Oh, no. He was preparing for a date, and he must have thought he was going to get lucky, and he wanted to get the hair gone. And he left it on way too long, and he got terrible burns.
Oh, that's horrible.
He was in so much pain, and this was not just recent. Like, he had been dealing with it for several days
before he came in.
And it was like infected, and it looked like a third-degry burn on his
that's
taint
horrible.
Area.
He did not get lucky.
No, I'm sure he did not get lucky. So do not use depilatory creams on the genitals or on the face because the skin irritation and the risk of burns is real. And there's a chemical depilatory cream that we can prescribe. It's no longer manufactured, I think, under the brand name of Vanica. But it is able to be compounded by compounding pharmacies, and the active ingredient is eflornithine. And so we can compound like a 14% eflornithine cream, and it works really well. And we'll often do that for women who get peach fuzz or, some darker hairs on the chin or on the upper lip. And it works well, and the risk of irritation is pretty low. It is safer to use on the face, but it's a lot more expensive.
Yeah. Well, you get what you pay for, right? In some certain circumstances. So if you're going to use something on the face, use the right thing. So. Next thing we have is laser hair removal. Yeah, a very common thing that we see. We offer it in our clinic, and I've had laser hair removal done a couple of times in my life. Yeah, and one of the most common things that we hear about or deal with when we have a patient asking about laser hair removal is it permanent?
Yeah, and laser hair removal is kind of a misnomer because it's not necessarily permanent. When you're treating hairs with laser hair removal, the hairs have to be in the active growing phase in order for it to properly target the bulb. And I guess we should back up and say what's going on here is we're using a laser in a certain wavelength. 755 nanometers is a really common, or just over 800, in like an Alexandrite laser. And what this does is it generates that light energy as heat down into the skin, but that wavelength specifically targets darker pigment in the skin. And so this works best if your skin is a lighter tone and the hair is darker, because then there's good contrast, and the laser energy will see that hair bulb, that dark pigment, and it generates so much heat so quickly that it permanently damages the cells that cause the hair to grow. But you have to go through several sessions because you need to catch all of the hairs when they're in the growing phase. And most of the hairs will go away and stay away, but people will find after several years of having had laser hair removal that sometimes some of those hair follicles start waking back up, and you'll get random hairs popping up. Yeah. It's usually never going to be that everything grows back unless the treatment was just underdosed, but you'll start getting a few. And so it's common that if you do laser hair removal, you'll need touch-ups from time to time.
Sure. So maybe laser hair reduction.
Laser hair reduction is probably a more accurate term.
Yeah. I've been hearing that more and more lately, and I think that's probably a good way to describe it.
Now, if you have darker skin tones and dark hair, we can use other lasers like a 1064 nanometer that is going to pass by the pigment in the skin a little more effectively and target the dark hairs. So if you are a darker skin tone, like a Fitzpatrick, 3, 4, 5, and you want some laser hair removal, you need to go to somebody with experience that has the right laser, which is a 1064. And we have that in the office. We have one that has both wavelengths for light skin and dark skin. And you're able to get some laser hair reduction. I still don't think it's generally as effective as light skin, dark hair. If you have light skin and light hair, laser hair removal is not going to help you very much.
No.
And dark skin is just a more challenging treatment approach, so you need to go to somebody that has good experience with it.
Yeah, and the correct laser, like you were saying. I often get asked, we get women coming in with that fine white kind of peach fuzzy hair, and they want to do laser hair removal, and we have to tell them, it's not going to treat that type of hair. It has to be kind of the darker, coarse, actively growing hairs.
Yeah, that's where eflornithine cream might be more effective. And the other thing we haven't talked about is electrolysis.
Yeah.
Electrolysis is what I'll often recommend to people who have terminal hairs that are light in color. So if your facial hair is coming in and it's blonde, laser hair removal is probably not going to be very helpful, but electrolysis can be a really good permanent way to reduce the hair. But it's a painful procedure to go through.
Yeah, it hurts.
So electrolysis uses a very fine pinpoint needle attached to an electric generator of some kind. And there's a couple different methods, galvanic or heat, but basically you're inserting that needle right down the hair follicle. You activate it and it zaps and burns the base of the hair follicle. It can permanently destroy it so that hair won't grow out, and then the hair can be gently plucked right out.
Yeah.
And you have to go through several sessions again because it can only work when the hair is in the growing phase.
Yeah.
But it is a very effective treatment, and the people that do that have to be very patient because it's a painstaking process to go through that.
Yeah.
You only treat one hair at a time.
Yeah, exactly.
So,
and another one that we haven't discussed, I guess you can be part of shaving, is dermaplaning.
Yeah.
So if you have those fine hairs, dermaplaning is a very popular option. There's lots of good kits online nowadays you can find at the store. There's one that you've mentioned a couple times that is a good kit to buy.
Yeah, I'm a fan of Jill Razor.
That's right.
Jill Razor uses a really nice handle with excuse me. Sorry, Carl, I coughed. Jill Razor uses a reusable handle that's nice and kind of hefty, and then the blades can be changed out. You get a new blade shipped to you every month, and I think it's just a higher quality device with a better blade than those Tinkle razors that women will buy over the counter. And COI, conflict of interest, full disclosure, I am on the advisory board and an investor for Jill Razor, so I want people to know that when I talk about them, I have a bias.
Yeah. Well, and I've handled the razor. It is good. It feels quality in your hand. It doesn't feel like a cheap plastic thing. Yeah. So
that kind of wraps up the basic ways that we could remove hair. And so before we get into the second half, let's talk about some random facts in medicine. We
have prepared for you guys some very interesting medical facts today, and I guess I'll start us off.
All right, let's hear what you got.
There's a study done, and I can't speak to how big the study was. It probably was just one patient.
Just a single case report.
A single case report where the patient was struggling with atrial fibrillation, so fluttering of the top part of the heart. And it was corrected to sinus rhythm by doing a digital rectal exam. So for those, a digital rectal exam is where you insert your finger into the rectum. And usually we do that to check for after trauma in an emergency. You can check for blood or nerves to make sure that the tone there's tone and there's tightness. Well, this happened to help the patient go into sinus rhythm, which I don't know what was being done.
It had to be connected to the vagus nerve,
something.
Yeah.
But so if you're in a situation where someone's in atrial fibrillation and you don't know what to do, you could try it.
I guess you could try it. I just have a fear that someday, I've flown a lot. I've taken a lot of trips, but I have never been on a flight where there's been a medical emergency.
Oh,
and I'm just
hopefully
worried.
You never are.
I hope I never am. But like, I know that if it ever happens now, it's going to be this guy's having AFib, he's lightheaded, and I'll be like,
"Where's it going?"
Well, this is the only thing we can do up here in the air. But yeah, like, I don't know. How do you get the idea that like, all right, well, let's try this?
I know.
You know?
It's like the first guy who ever tried milk. You know, it's like how do you explain that to his friends?
Yeah. Well, when you have atrial fibrillation or an irregular heartbeat, one of the maneuvers that we will put people through to try to get it to calm down is a Valsalva maneuver.
Yeah.
And so if you can imagine, a Valsalva maneuver is like this straining that you do when you're going to the bathroom, trying to push one out.
Yeah.
Hold your breath and bear down. And sometimes
pilots will do it.
Yep. The vagus nerve, it stimulates the vagus nerve that can convert the heart rate. We'll do carotid massage because there's nerve bundles in your carotid artery that go back to the heart. And so that, they must have tried those things.
Yeah.
And then they're like, well, let's really stimulate the vagus nerve here. Let's go for that parasympathetic. So interesting case report.
Yeah.
I have another interesting one that I saw pop up. Is there was a lady who was receiving a liver transplant, and the lady was a fairly thin lady, but she needed a new liver, and the donor that she was receiving the liver from must have been a much bigger person because this liver was bigger than the liver they were taking out of her.
Gotcha.
And so when they were putting that liver in and then trying to close her up, it was compressing the liver and cutting off the blood supply. And every time they tried to close her up, they could see that the liver started to change color because the blood supply, and they knew if they closed her up, the liver was just going to die and then she would die. And they didn't know what to do. And so they called a plastic surgeon because plastic surgeons do a lot of trauma. They put people back together in creative ways. And they were trying to describe to him what was going on. And they couldn't keep the liver in the right position when they started closing her up. And he suggested that they take a breast implant and put it behind the liver to hold it into place so that they could close the patient up. So they did. So this lady has a breast implant put behind her liver, and then they were able to sew her up, and it kept the liver in the right position and saved her life.
Amazing.
It's the strangest place I've ever heard of a breast implant ending up. So
she can say she has implants.
She has an implant. That was before I got my breast implant.
That was before.
What?
Oh, wait, really?
Yeah, it's behind my liver. So, well, to the audience, we want to know if you would like to hear more random medical facts and studies like this, or if you like the Did You Know random trivia that we come up with. So send us a message on Instagram at skinfluence_pod, and we look forward to your feedback. Yeah. And with that, let's jump into the second half of the episode. So if you are entertaining any of these methods to reduce the hair that you have, whether it's shaving, whether you're prepping for laser hair removal, using a depilatory cream, there's a handful of things that are pretty universal that you can do before any type of procedure that should help your skin to tolerate it better, to reduce the risk of ingrown hairs, and then things that you can do afterwards. So let's talk about some of the things we might encourage people to do before, shaving or laser hair removal.
Yeah. So for shaving, like I had kind of alluded to earlier, it's good to kind of create a routine around shaving and not rush through it. If you're going to be using a blade, there's a lot of people who dry shave. Mm-hmm. I could never do that.
I couldn't.
That's just too harsh on my skin, and I don't really recommend it for people to do. But there are people who do it and they handle it fine, and that's great. But usually prepping the skin with some sort of like a shaving cream. Some people can't tolerate a lot of shaving creams because there's preservatives and there's there's alcohol in some of them or propylene glycol, and it can burn a little bit. And so Dove and a lot of these companies have made shaving creams for sensitive skin people like myself. And so using a prep, washing the face using a hydrating cleanser, and then using shaving cream. When we mention washing the face, people think we want them to be really aggressive and like wash the bacteria, wash things off. When really, I want gentle face wash. Just gently wet the face, gently rub the wash on with your hands, and then pat dry. So prepping your skin, moisturizing your skin, and then afterwards using some sort of a repair cream or a moisturizer to just help the skin repair after you've used something abrasive on it.
Yeah. When people are prone to ingrown hairs on the neck or the back of the head, I'll often encourage them, like you said, to gently cleanse and then do a hot towel. I mean, I love that experience if I occasionally go to a barber for a shave.
Yes, 100%.
And but the hot towel feels really good, but it does help to get some blood flow and gentle massage to loosen up the hairs with the washcloth.
Yeah.
Not hard, not aggressive, but just get things to stand up off of the skin a little bit better so that the blade that you pass over there or whatever method you're using can have a better chance to pick it up without having to go over it multiple times with the razor.
Totally.
And then I agree, after shaving, using some type of moisturizer. People use aloe. If I'm getting irritation, I'll use like a Thayer's Milky Toner or their hydrating toner, which is mostly like water and hyaluronic acid, just to kind of put a little moisture on the skin.
Yeah, and I typically, I'll use like an HA, sometimes hyaluronic acid, or like vitamin C serums.
Yeah.
Usually pretty soothing afterwards.
For sensitive skin, shaving creams, I really like the one Aveeno makes.
Oh, yeah, I haven't tried that one.
Theirs is really good, and it was not intended to be a shaving product, and I wish I could remember the name of it. It was from Beekman 1802, and it was some type of like oil cleanser, but I found using that in the shower when I was going to shave my head with that Gillette, that was the best thing I've ever used.
Really?
I need to get another one. Yeah, it was like an oil cleanser from Beekman 1802.
So you put that on and then shave over it?
Shave over it. It wasn't intended to be a shaving cream, but it worked really well.
Huh, that's interesting.
So now prepping for laser hair removal is one of those things where if you have to shave before laser hair removal.
Yep.
If let's say you're getting your back done and you've got long hairs, if you have all of those long hairs on there, the laser is going to see all of that pigment and it's going to absorb so much heat, you could burn the skin.
Yeah.
You could really be uncomfortable. And so ideally before laser hair removal, you would want to shave. You don't need to like bick it, but you need to get a good trim so there's just barely any hair that you can see. And ideally you would do this maybe even just a day or two before. So we want the hair bulb to be there. We don't want to wax it. If you waxed and then tried laser hair removal, there's no target for the laser to hit. So a shave, a trim, just a tiny bit of hair, then the laser can see that.
Yeah. The ideal situation is you're shaving with a razor, getting a really close shave. But if it's in areas that are hard to do or things like that, using a trimmer to get as close to the skin is okay.
Yeah.
And then they'll when you go, they'll clean the area and make sure all the debris is off. When I've gone in, I've liked to go freshly showered, to make sure like everything's I'm clean before we go in, because going in after like an exercise or things like that where you're sweaty can refract some of the laser and can cause some damage in the skin.
Yeah. So. The other thing is that you should not be tan when you go for laser hair removal. Like we talked about, darker skin tones have to be more careful with laser hair removal. But if you're fair skin, but you go out and get a bunch of sun the week before and you come in with a tan, any good laser technician or dermatologist should turn you away and say, we have to wait until that tan fades.
Including spray tans. Spray
tans as well, yeah. So bare skin, as fair as you can be, is going to stand the most chance of success. When I was in residency, there was an interesting case series that was done by another resident in Michigan, where they had people use minoxidil for several weeks before laser hair removal, which seems paradoxical because minoxidil promotes more hair growth. And you're like, why would you want more hair growth when you're trying to remove it? Well, what they did is they had people use this, I think, for 3 months before laser hair removal.
Oral or topical?
Topical minoxidil. And it put more of the hairs into the growing phase.
Oh, okay,
and
that
so
makes sense.
Patients in this trial were able to do fewer treatments of laser hair removal because they activated more hairs to be in the growing phase and they had more effective treatments when they went in for laser hair removal. And I thought that was interesting. I haven't seen it as something that has been widely adopted, but interesting nonetheless.
It isn't. It makes sense, at least.
So,
and then after laser hair removal, we say same thing. Don't go out and get sun. Don't go tanning. Your skin's going to be sensitive for even up to 48 hours after you have the laser. So protect yourself from the sun. Use moisturizer. You want to provide an environment for that skin to heal if there's any damage that was done to it. So just be careful and gentle with your skin. Typically after you have a laser hair session.
Talk to the person performing the procedure, what kind of aftercare products that you can use. The one that we're recommending today is our product of the week. We're not closing out yet, but the Botanical Calming Serum from Dean Skincare has a lot of anti-inflammatory, antioxidant ingredients to really help calm and soothe the skin. And that would be safe post-procedure on something like laser hair removal. And we'll have a link to that in the podcast show notes and the YouTube video description.
Yeah. And then another thing to consider if you struggle with ingrown hairs on the neck or in the back of the scalp and things like that, where you get a little bit of acne, keloidalis, nuchae, or you get lots of pseudofolliculitis, barbae, is laser hair removal.
Yeah, it can be highly effective. Laser hair removal is another procedure we recommend for people who have hidradenitis.
Yes.
Hidradenitis suppurativa commonly affects under the arms, in the groin, and there's really good data that shows removing those hair follicles decreases the number of boils and flares that somebody might go through.
Yeah.
And in some cases, it can get covered by insurance.
Yes.
So I have performed a case on that for somebody who was, they had a pilonidal sinus, and laser hair removal was approved by their insurance to help reduce those hairs so they weren't getting as many flares of the pilonidal sinus.
Yeah.
Which is somewhat related to hidradenitis.
Totally.
So when it comes to some of the other hair removal strategies like electrolysis, very similar to preparing for laser hair removal. Clean skin, don't come in with products on your skin.
Yeah.
Gentle care afterwards to soothe the skin. When it comes to the depilatory creams, if you are going to use those, they need to be put on clean skin, and don't leave them on longer than is recommended on the bottle.
Yeah. One of the topics that we're supposed to discuss are skin damage mistakes, and I have a confession.
Oh, let's hear it.
So, as I mentioned, I was on the water polo and the swim team growing up. And so before swim meets, we would shave. And there was one night, it was late, it was probably like 11:30 or midnight. We're at the Taco Bell parking lot, and we forgot. We were like, oh, we were supposed to shave for our meet tomorrow. And we got the idea to spray Axe body spray on our chest and abdomen and then light it on fire.
Oh no. Oh no.
We were hopped up on Baja Blast. And cheesy gordita crunches.
Oh my gosh.
And decided to do this, and we did it. It burned the hair off. But the police came because they saw balls of fire going. Someone called the police on us, and we didn't get in trouble. They thought it was funny, but we were pretty slick the next day.
Did anybody get hurt?
Nobody got burnt. Some eyebrows got singed.
I'm sure.
But that's about it.
I'm sure. Oh my gosh, Austin. That is a crazy story.
I know.
We have to clip that for a short.
Yeah.
Yeah.
That's my big do not do this hair removal technique.
Please don't light yourself on fire. It will remove the hair and potentially other things.
It removed the hair nicely.
Oh, I was not prepared for that.
Yeah. I saw this episode coming. I'm like, I'm going to have to tell my story.
We have to tell it.
Yes,
I'm glad you did.
Me and 3 other guys did that. And you look back on life and you regret things that you did. And that's one of them.
Hopped up on Baja Blast. Wow. I think we close it out there. I think that's a great place to end. With all of these things, if you don't know what is the right approach for you, see a dermatologist.
Yes.
If you've tried things at home and you're having problems with ingrown hairs or shaving bumps or a lot of sensitivity, see a dermatologist. We can help to develop a plan that will keep the skin healthy and get you the result that you're looking for.
Totally. And there's lots of options for people, even if you think that you're growing hairs and there's, nothing seems to be working. That's where we come in. We have lots of techniques like we discussed today to help you out. So choosing the methods, there's a lot to choose from, and we're here to help guide that.
Yep. And as always, you can find me on social media on all platforms at Dr. Dustin Portela.
And you can find me on social media at Austin Lee, PAC.
Leave us a 5-star review wherever you listen to podcasts. Share this episode with a friend. It would greatly be appreciated to help us grow the podcast and reach more people. And we'll see you next week.